My name is Ralph Mösges, and I want to give you a short introduction into our paper, which describes a randomized double-blind placebo-controlled dose-finding trial, a first-in-human study with mannan conjugated birch pollen allergoids. This is the study design. It's a so-called hybrid study in which patients were treated before the birch pollen season, and they received one of four dosages, either placebo, 1,000 mannan therapeutic units, 3,000 or 10,000 units per mil, and on 5 visits injections were given. Each time half a mil was applied. There was a nasal provocation test conducted before and after the treatment phase, and then the patients were followed up into the season, and during this season with an electronic diary, the combined symptom and medication score was measured. This is the patient allocation. More than 300 patients were recruited to randomize 246 patients, and they were equally distributed among the 4 treatment groups. This is already the primary outcome parameter, the so-called CSMS, and we see a clear dose-dependent relationship of efficacy, which is even more pronounced in those patients receiving their treatment completely before March. As for the immunogenicity parameter, BET-V1 specific IgG4, there is also this dose dependency with the most pronounced effects of a 5-fold increase compared to baseline and the group receiving 10,000 units. This is also reflected in the other immunogenicity parameter, the facilitated antigen binding. As for safety, we also see a certain dose dependency, namely in the application site reactions, which were a bit more frequent in the group receiving 10,000 units. And also in this group, we had 2 out of 61 patients with systemic reactions. Both were of mild or moderate character. All the systemic reactions, 4 altogether, were recorded in the actively treated group, and they were all grade 1 or grade 2. So as a conclusion, we can say that in this dose-finding study, 10,000 mannan therapeutic units demonstrated a good efficacy, safety, and tolerability, and it was therefore chosen for the further drug development in phase 3. Thank you very much for your kind attention.